Hi, my name is Ed Humbert. I'm an orthopedic surgeon at Joint Implant Surgeons. In this video, I'll outline some important benefits and risks and complications of orthopedic surgery and joint replacement. The benefits of joint replacement are reducing pain, improving mobility, reducing stiffness, and getting back to your active, healthy lifestyle. Just like anything, there's risks and benefits to surgery. Just like you can drive your car home, you can get in a car accident, surgery is no different where there's risk to surgery. We try to improve those risks and reduce them to the lowest amount. But we have had patients in the past, if we do enough surgery, some of these complications are possible. Number one would be an infection. Infection is something that can happen with any surgery. If someone does get an infection, we certainly know how to treat them and deal with them, but that's one of the risks of any surgery. Patients in general come with their own risks, and their extra comorbidities are the things that increase their risks of infections. For instance, patients that have obesity, they're smokers, they're diabetics that are uncontrolled, all increase risks of infections, where lots of patients ask us, what is our risk of having surgery and what's our surgical complication of surgery? We ask the patients the same thing, where the more comorbidities they have, the higher risk they have of having infections. Blood clots, which are called deep vein thrombosis, or DVT, is a risk of surgery. Blood clots after joint replacement are not that common, but they can occur and cause some swelling and pain in the leg. Blood clots by themselves can cause pain and swelling. The higher risk is that blood clot that forms in your vein can break off, and a bigger clot can float up to the lung and cause what's called a pulmonary embolism. Pulmonary embolisms can cause shortness of breath, hard breathing, and also death, which are very uncommon, but they can occur with joint replacement. Blood loss is another common occurrence with surgery in general. Everyone loses blood. At this point, the types of surgery we do are minimally invasive. We try to reduce the amount of blood loss where it's very rare to need blood transfusions. These days, although if someone comes in with a significant amount of anemia prior to surgery, they have a higher risk of getting a risk of blood transfusions. Pain after surgery or tendinitis is common. At the initial part of surgery, which will improve over that first 3 months to 6 months after surgery. Swelling is 100% of the time after any surgery, which will dramatically improve over the first 3 to 6 months. Dislocations, specifically with hip replacements, are very uncommon with our approaches of surgery these days, but can occur. Wound drainage is also another common thing after surgery, where the wounds can drain quite a bit for the first day or two. Significant drainage is uncommon, and we would have to see patients for that. Healing is another thing that's very dependent on patients. Diabetics, obesity, poor vascular supply to legs reduce the benefits of healing, or the propensity to heal, and they can have more problems with that. Poor results speaks for itself. Patients may not do as good as they think they're going to do. We try to optimize every patient before and after surgery to optimize their results. There is potential for reoperations of surgery because there's risks of things like this, these infections and blood clots and fractures can occur. Amputation, potentially after a joint replacement, is extremely rare. I've been working for 18 years and that may have occurred 2 or 3 times, but in the occurrence of recurrent problems and fractures and infections, that's a potential risk of any joint replacement, whether it's the hip or the knee. These parts are man-made parts. They can loosen and wear over time. We hope that the joints we're putting in today can last up to 30 or 40 years, but eventually they can loosen and wear out and have to be redone. The nerves and vessels that we're working around with your hip and knee are very close to where we're working. We know where they're at. We've never gotten near them or injured them, but nerve injuries can come from just traction or any pulling on the nerve. While we're doing your joint replacement, we're dislocating the joint and putting in the implants, and the stretching of the nerve can cause nerve damage or a nerve palsy, which can last 3 to 6 months at times. Injuring tendons, ligaments, and muscles around the joint, again, are extremely rare and uncommon. If they occur, we can repair those tendons, we can repair those ligaments. It's just something that can happen. People can also complain of recurrent pain after joint replacement or pain for prolonged periods of time. That's generally assuming there's no major problems with the alignment or infections of the joint. We can continue to do conservative care for that. Hip replacements can develop bone formation around the part called heterotopic bone, which is again a rare complication of joint replacement, but is there. Phlebitis is another common occurrence of hip and knee replacement with swelling in the leg, which can cause some vein swelling. Anesthesia risks are there with heart and lung risks, which can be strokes, heart attacks, things like that after anesthesia. Nerve injury is one thing, but superficial nerve sensation loss after joint replacement is common locally around the incision, where you can get some decreased sensation around the hip or the knee. Reflex sympathetic dystrophy, or RSD, is a hypersensitive pain syndrome that you can develop after any kind of major surgery, which can give you a hypersensitive or over-the-top pain that's not common after any surgery as well. It's important that you understand there are risks and benefits to surgery. We thank you for choosing the best surgeons in the joint.